So good afternoon, everyone, and thank you for joining today's webinar. It is really the first step that the Department of Health is taking to educate on the community health worker role here in South Dakota. So today I'm here just really to give that overview of the various steps that have taken place here in South Dakota to advance community health workers over the last 4 years. And so what you see here is the timeline of those various steps that have taken place. And so really it started back in the fall of 2015 when our previous governor, Dennis Dugard, convened the South Dakota Healthcare Solutions Coalition and tasked them with the development of a solution that supports increased access to healthcare for the American Indian population and to help improve health outcomes for that population. And so one of the recommendations that came out of that work group is to develop a community health worker, community health representatives, which is another term that is used for this role within our tribal areas. And so, and to formulate a plan for reimbursement through our Medicaid state plan. And so, the next step here is to help the Medicaid state plan in rolling out that reimbursement model. The Department of Health co-chaired a statewide work group with the Medicaid program, which involved various partners from different organizations like healthcare, public health, Indian health services, tribal health programs, that were tasked with developing a summary and recommendations document. And so that group really looked at national resources, reports, studies that have been done, also understanding what was happening with our community health representatives here in South Dakota, which have been in place for over 50 years. And so learning from them on what that role and the types of services that they can provide and the types of skills that they have. So we really, within that recommendations report, we looked at scope of practice. So those types of services that they would be looked to providing, like resource coordination, coaching, support, group education, and providing that cultural appropriate health information to various group populations. And then they also looked at core competencies. And so those skills that someone within this role should have, demonstrating competency in motivational interviewing, demonstrating cultural competency, understanding different community resources that are available. And then the other component to that recommendations report was looking at education and training. And so they looked at other states' curriculum, some of which you will hear from today, and looking at, what they have in place to start educating these individuals on, developing those skills and those competencies to be successful in this role. And then the third step here is the actual implementation of the community health worker reimbursement model within the state Medicaid program. And I'm excited to announce that it was rolled out on April 1st of this year. And so that is currently available. And I will say, you can find more information on their website, which is dss.sd.gov for more details. We also plan to do a follow-up webinar to this in working in partnership with our state Medicaid program to go into more detail about what that reimbursement model looks like and some of those details of how to go about enrolling within the Medicaid program and reimbursing for those different services. And then the fourth bullet here, I just wanted to bring awareness of some education and training that is currently in place for community health workers within our state. And so the Indian Health Service, like I said, has a long-standing community health representative program, and they have a very comprehensive curriculum. And so, that's definitely a curriculum that we're promoting and encourage folks to take advantage of. And we also have had conversations with Lake Area Technical Institute, their 2-year university, and have gotten approved through the Board of Technical Education to offer a community health worker program at their school. They have both a 6-month, 1-year, and 2-year program, and they're launching that program fall of this year. So another great opportunity for if you have current staff that are interested, or if you know of us, someone within your community that might be interested, that's a great opportunity to get the appropriate training that you need. And then also this morning, I just wanted to give a preview of some of the work that is currently happening within various programs within the Department of Health around community health workers. And so through the Cardiovascular Collaborative, which is a statewide stakeholder group with the mission to improve quality of health of all South Dakotans through prevention and control of heart disease and stroke. And so they, I have had the pleasure of leading the Goal 2 work group, which is focused on looking at priority populations and helping them decrease heart disease and stroke within various population groups. And one of the priority strategies over this last 6 months to a year was looking at community health workers and the role that they can play in heart disease and stroke. And so today is our first step with this webinar to start educating healthcare providers and facilities about the CHW role and what that could look like within your organization. We're also in the final stages of a promotional document that will be a print resource available on our website that really defines what a community health worker is, the role that they can play, how it could benefit your organization. And we also highlight a success story even that is happening here in South Dakota of how they've utilized a community health worker and the health outcomes that they're receiving with some of their patients that CHW is serving. And so a lot of great resources that will be available here soon to start the conversation within your facility and other providers about this role and how they can benefit you and your patient. And so more to come on that. We also, through talking with a small amount of healthcare providers, one of the things that came up was looking at some assistance around the hiring process of a CHW. And so we're looking at developing a toolkit, a packet, or just a few resources pulled together that can help those providers, those facilities to be looking at how do I go about hiring a CHW? What could that look like? I feel like, this really is a different type of profession that more than likely won't have, letters behind their name, a standard training. It may look really different depending on what your needs are for your facility and for your patients and what type of level of education that you're needing to perform those different roles. Also, I will mention through our heart disease and stroke program and diabetes programs through federal funding that we receive, there's a strong emphasis on community health workers and the role that they can play in reducing heart disease, stroke, and diabetes. And so we're going to be looking at also providing some ongoing training, particularly around those chronic conditions, but also looking at others and how we can support CHWs and the different roles that they could play if they're going to be working more with diabetes patients, providing that ongoing training for them to learn more about that disease. And so really looking at that's our role as the Department of Health, that we can provide that additional training for them. And also we know for sustainability for CHWs and for them to learn from each other and think, to support each other in the work that they're doing, we're looking at starting a statewide alliance, coalition for them to come together and meet each other and hear about the type of work that they're doing and hear their needs, if there's additional training needs they need or resources that would help them in the work that they're doing. So we think that that's a really important thing to be looking at as we're starting to build up this profession here in South Dakota. So I'll close and just thanking you guys again and excited about hearing more on this webinar about what other states are doing and just really getting the conversation going here in South Dakota.